This video will explain what you can do if you have a problem, especially with a wisdom tooth. And as we know, everyone's mouth is one of the most dirty places on the body. It's full of bacteria and bugs, but they kind of live in a harmony, hopefully, if you look after your mouth well. But if it doesn't, then you start to get swelling around the gums. And the swelling is a reaction to this change in bacteria, which we tend to say comes anaerobic. And what can happen in about 10% of the population is it has a detrimental effect on the bone supporting your teeth, never mind the decay that you may get on the teeth themselves. So with periodontal disease, you can get infections in the gums even though the tooth hasn't got a filling. And if you haven't seen a dentist and had your gums checked, the first time you may notice you've got it is when you need to have the tooth out. It's the most common cause of tooth loss over the age of 35. So if you've got a swelling adjacent to your tooth, especially if it's not filled, it's possible that it's caused by a bone loss around the root of the tooth. And you need to clean out the pocket using one of these super interspace brushes and continue with your normal routine interdental cleaning. As the swelling goes down, the bleeding should stop, and you might get a little bit of root sensitivity, but you can use toothpaste for that. And the one that is common in about the 18 to 25-year-olds is the swelling right at the back. So that's specifically when you have an extra tooth, which everyone knows as a wisdom tooth. And when this is trying to come through, sometimes the gum here swells up and you get this change in the bacteria. You tend to bite a bit more on the gum, which doesn't help. And so the best thing is to keep the gum clean as best you can, using your electric brush on the area and using the Corsadil applied directly over the swelling. And do the Corsadil a different time to when you clean your teeth, because it's inactivated by the toothpaste and also causes staining of your teeth. And sometimes the sides of your face can swell up, in which case you'll need antibiotics. The best analgesics are something like Nurofen, and book in to see your dentist.